For this next technique, I'm going to show you how to manipulate the C7-T1 junction, which is known as the cervical thoracic junction. And it relates to the C8 nerve root. So the patient might have tingling towards the ulnar side of their hand in here. Now, with this one, I'm going to use my MCP joint, so the metacarpal phalangeal joint in here. And the idea would be that this joint comes directly onto the transverse process of C7 affecting the T1. And the idea would be that we would side bend towards and rotate away because we would induce a type 1 motion because of a dysfunction would be known as a type 2. So the MCP joint is going to come down towards, so where the butterfly is on this model, so my thumb is onto the spinous process of C7, so I'm going to come over to the transverse process and I'm going to bring my MCP joint coming down to that level, and the angle is going to be towards the opposite axilla. So I'm going to slowly side bend, the hair shows a lot of hair, side bend down towards and rotate away until you feel tension into the hand in here. Be careful in this hand. So the idea is that you stabilize with this hand. A lot of therapists might use what they call an 80-20. So I'm going to thrust 80 and use my hand on the head to do 20. If you can, I suggest we only do 100% thrust from this hand, okay, and then we stabilize only from the other one, okay, but it depends on how you've been taught this. Okay, so I'm going to come in and mobilize coming in through here. This is a mobilization technique. Take a breath in, please. And as she breathes out, stabilize, and then the thrust is going to be directly through, and that cavitated lovely just on that joint. Okay, so that's how you'd manipulate the cervical thoracic junction using the MCP joint.